Welcome to today's talk session. My name is Deidre Moss, and I am the host of Can We Talk. I'm an educator, motivator, and a talk connoisseur. In our session today, we will focus and talk about diabetes awareness and prevention. And although we would have closed out the month of November, which is recognized as Diabetes Awareness Month, we thought that talking about diabetes awareness and prevention is still pretty much relevant. So in our session today, we will focus and talk about diabetes awareness and prevention. And we will have a regional talk today. And we're excited to welcome Dr. Diane Brathwaite.
Hello, good day.
To our platform. Dr. Brathwaite is the clinical director of the Diabetes Foundation of Barbados and a member of the Barbados Childhood Obesity Prevention Coalition. So Dr. Brathwaite is here to help us dissect this topic today. So at this time, I will pass your mic to her to have her introduce herself.
Hi, good day, Deidre. So first of all, it's Friday, we can drop some of the formalities. I'm Dr. Brathwaite, but you can also call me Diane. My name is Diane Brathwaite. I live in Barbados, but mind you, I've lived in several Caribbean islands. So I kind of call myself a slightly bit more multicultural. And also, I work as a doctor here in Barbados right now. What do I tell you about myself? I have many passions in life. It's Friday, so excuse me if I'm less formal, okay? Many passions in life. Obviously, medicine is one of them, and also preventing good health, but I also enjoy just being physically active as well, and mentoring young people and working with people with disabilities as well. From the point of view of medicine, I work in the area of diabetes. I would have studied medicine at the University of the West Indies, both in Barbados and in Trinidad. Then I came back to Barbados where I would have done my internship. I would have done my rotations in internal medicine. And then I went to the United Kingdom where I studied in the areas of diabetes and endocrinology. It was always my intention, actually, very purposefully, to work in the area of diabetes. And this was actually influenced by a very simple experience. Working in the hospital, of course, you always tend to see the worst of the worst. So really and truly, I saw some things that nobody would ever really want to see from diabetes, you know, and in young people in their 20s, 30s, and 40s, and people losing their lives at those ages from diabetes. So that was something that was very shocking, you know, obviously to my system, because, you know, I understand diabetes is a condition that you can live with, you know, for life, even if you get complications. That was my perception of diabetes then. But I remember I was at the hospital. It was probably maybe my fourth or maybe my fifth year of internal medicine. And I mean, I did have one or two colleagues who were diabetic, but then I was like, oh, they're doctors, they know what to do, so they'll be okay, you know? That was my thinking at that point in time. But I remember I met a lady who came off a cruise ship from the United Kingdom. She'd had type 1 diabetes for 50 years, and she had not one single complication. I was totally blown because she was in her 70s, 70. And what also interested me was that instead of her being told what to do, she was telling all the doctors and the nurses what to do and how to manage her. And that was an experience that I never had. And so it really convinced me that, you know, actually I needed to seek out this way of empowering people so that our people in the Caribbean could actually be like this woman, you know, and hopefully stop some of those horrible things that I saw at a young age. So that's me. I mean, there's lots more to say about me, but I'll stick to diabetes for today.
And I know you said, you know, this is Informal Friday.
Informal Friday, yeah.
It's Informal Friday, but I just want to be mindful that, you know, you work hard to get that title. So, you know, I just want to be mindful. You know, some persons, they are very protective of that title. So.
Well, I'm not such a person, and you can't say my title. My name is Diane first and foremost. So it's okay, you know.
Okay.
It's fine. If you prefer Dr. Brathwaite, some patients call me Doc, some call me Dr. B, whatever. It's all good.
Yeah. Okay, thank you so much. And so you provided a little bit of background into, you know, how you would have entered into your career.
Yeah.
For our viewers, our listeners, can you tell us just touch a little bit on yourself? I know you touch a little bit, but is there anything else you want to share?
I it's so funny. 10 years ago, I'd been sure tons. I just spent a lot of time working really hard, you know. It's a lot of hard work right now.
Yeah.
I'm also like a member, as you can see, of the Childhood Obesity Prevention Coalition. I have been working with them very closely. I think it's probably the last 3 years or so. So in Barbados, this coalition involves a number of organizations, non-governmental organizations that have come together, educational organizations, religious organizations, and we're all about promoting healthy nutrition and lifestyles for children. Now, why do we think this is important? Because we know in the Caribbean, conditions like diabetes and hypertension and cardiovascular disease, they're major problems. I mean, our prevalence rates are 2 to 3 times, you know, the rates in other developed places, you know, or in other largely Caucasian populations. It's a huge problem. Not only does it consume a lot of the budget, which we don't have anyway, you know, but you're also going to be dealing with a lot of complicated people and a lot of complications. The more diabetes that you have, the more blindness you're going to have, the more heart attacks, the more strokes, the more kidney failure, the more dialysis patients. And so I think we've come generally to the understanding that really a lot of effort and energy must go into prevention of NCDs and not just merely diagnosing or treating NCDs. That's very important, but we feel that more effort at this stage in 2021 must go into prevention, because prevention is really going to be our way forward, especially when we know that rates of diabetes, hypertension, all those NCDs and obesity are actually climbing, you know, like that, you know. So we have to prevent, otherwise we're going to be at a little pinnacle, and the pinnacle is not going to be pretty, because I'll share something about that pinnacle story later. And we want to prevent our children, you know, from going there if they don't have to in the first place. Yeah. So other than that, I mean, I dance. I have a small dance company. I work with people with disabilities, and you know, we have a good time. We have a children's group and an adult group, and yeah, that's what I do mostly, other than practicing medicine in Barbados right now at this point in time.
Yeah. You are so busy. And you talk about working with persons with disabilities as well, and sign language is awesome stuff. You know, we spoke about that as well. So we would love to connect with you on that aspect. That's awesome. And so you're definitely a busy lady.
Yeah, yeah. In Barbados, we have, sorry, I was just saying, we have, you know, we have smaller groups now that are promoting, you know, the arts, obviously within the disability sector. I mean, inclusion is just so important.
Yes,
yes. And obviously, having been in the UK for a long time, I would have had a different experience of inclusion as to compared to where I was. So I want to be a part of that process, whatever that means. And I know what it means for me, but, you know, whatever it means to other people as well. But it's also just remembering, you know, that when we include, we have opportunities to introduce health messages. We have the opportunity to bring in physical activity, because think about it, NCD rates are actually going to be higher in disabled populations because of their immobility, basically. And also a lot of our NCDs really are, you know, causing these acquired disabilities anyway. I mean, diabetes, if you think about it, is probably the #1 cause, you know, of blindness, right? So you have to think about it both ways. Everybody that you see with a disability is not born with a disability, but still at the end of the day, everybody is entitled to the same, I would say, access and ability to have the same type of life. How we explain it is, say, for example, if John needs to step on this to see over the wall, and Sue needs on my computer thing to step over the wall, they need different tools, but they have the right to have the same experience, basically. So that's something that's very important to me and dear to my heart in terms of equality. Yeah.
Awesome, awesome. And you kind of glazed over some important key points. I know, you know, someone, another doctor I would have connected with, Dr. Fox, said that, you know, we in the Caribbean, we like to be #1, but hitting those #1s in a good way, you know what I mean?
Yeah, yes, it's true. Yeah,
you know,
yeah.
we love to be
diabetes or amputations.
Oh man. Yeah, you talk about prevention, the importance of prevention, and you know, they always say it. You know, I had the saying, you know, prevention is sometimes better than the cure, and so prevention is definitely so important. So I want to thank you for sharing those important points.
Sure.
And like you said, I mean, you talked about with diabetes comes blindness and, amputees and
And
strokes.
strokes, yeah. Yeah, and all those other things. There's so much. Diabetes causes so many complications. I always explain it, when I'm teaching, how I simply explain it. When you have diabetes, you have an excess of glucose, or what people call sugar, in your bloodstream. But remember that your blood flows from everywhere, from the very top of your head, your brain, right down to your little toe. So it means that this sugar in excess, it causes damage, and it can damage anywhere from the top of your head, your brain, right down to your toe. We're talking head. We're talking eyes, we're talking all your nerves, we're talking your heart, your liver, your kidneys, your sexual organs, your circulation, your limbs. It just works right through your whole body. It's very, it can be very damaging. And as I said, I've seen a lot, obviously, because I've been working in the area specifically of diabetes since 2001. And, when people start getting complications, it's rare that they just have a complication in one place. They normally have complications, obviously, in multiple organs. So sometimes also when I teach, I say that diabetes is a multi-systemic disease, meaning that it damages or has the potential to damage multiple systems in the body at the same time, So it can be a very destructive disease if not controlled, obviously, over the long term.
Yeah. Wow. Thank you for sharing that information. And can you tell us about your role and responsibilities as the clinical director of the Barbados Diabetes Foundation? And also, can you tell us about your role as a member of the Barbados Childhood Obesity Prevention Coalition?
Okay, so my roles at the foundation, obviously I'm in charge of what we call a multidisciplinary clinic here. So we will have all the different specialties that would be involved with the management of people with diabetes. So podiatrists, educators, dietitians, we have a cardiologist on board, eye screening. So just the various subspecialties that exist. I would just be in charge of helping to kind of coordinate their services properly. Okay, mind you, all of these people are specialists in their own right. It's just about bringing everything together, creating the programs. At the center, we actually treat persons who are referred from our public healthcare centers, and also people who come privately who might self-refer, or their doctor might refer them for a specific service or whatever is the case. And beyond being a doctor, clinical doctor, which that takes up a lot of my time, obviously, I also design programs for the foundation. I also design other programs for other organizations as well, depending on what they want. Educational sessions for the community, and sometimes also other healthcare professionals. I act as an advisory to kind of diabetes task force, both locally and regionally as well, OECS. I partner and I work with Healthy Caribbean Coalition. From the point of view of the coalition, being in the coalition is a lot of fun, okay? It's a lot of fun. Their chat gets really busy. I'm not a WhatsApp group kind of person, but the chats get very busy. But I often get called for the diabetes talks and just the general educational talks, and to go on, whether it be the radio or media, to just represent our cause, which is childhood obesity prevention, and also reduction in sugar sweetened beverages and front of package labeling as well. And, my activities take me from anywhere to a radio, to a cricket pitch with people, or to wherever, most recently, which is very interesting, we were looking at alternative snacks led by dietitian Nicole Griffith. And with Nicole Griffith, she's a dietitian, myself, Professor Ann St. John, Francine, and some other people. Nicole had us in the supermarket pulling down people's labels, okay? And so I am there walking through the supermarket with my camera, and I'm thinking okay, I hope nobody stops me trying to snap labels, because we're trying to pull out, all the foods that are, lower in sugar, so that maybe we can help people, give them some guidance as to what they can get. So we do lots of things like that, and conferences, regional conferences. So it's a lot of fun still, and it's good to work with people from other organizations. So from that point of view, I think those are my main responsibilities here. But yeah, the administrative side gets very big, and the planning and programming. Yeah.
Awesome, awesome. And I just want to mention Francine Childs. Thank you so much, Ms. Childs, for helping to facilitate this session. I appreciate you. And Dr. Brathwaite, you talk about going into the store, pulling down labels.
Yeah, it was very funny. I felt very like, I swear somebody's gonna like stop me and ask me, what are you doing? You know? So
where was this? This is in your country?
Yeah, in our country. So we divided it between us and we went to all the major stores and we went looking at all the snacks and the beverages. And I mean, I'm sure some of them went very proudly and just took their pictures and wrote in their pad, but I was like undercover, you know, it was like, I didn't want to see people see me snapping, but the quickest thing was just pull out your camera and just, you know, take a picture of the label. And then, you know, I was probably the lazy one in the group. I was actually very busy. So I just sent Nicole all my pictures and she worked out. But all of the other people, they actually wrote everything out on the table. Nicole did mine for me. So Nicole's going to get due credit right now. And but it's a very useful exercise because I think what it helped me to realize even more than I realized already was that it was actually really hard to find snacks that were low in sugar and low in sodium. And I left thinking like, so what am I going to drink? Soya milk and what else, you know? But they did find other things that I wasn't able to find. But it just shows you that if you don't really look at and compare labels, sometimes you can be very unaware of what is in your product. And even things that are kind of promoted as being very healthy for children, you know, they're full of salt or they're full of added sugar, you know?
Wow.
So, yeah.
So these were just kid snacks that you looked at, or just
we looked at snacks. We were looking mostly for snacks for children, basically, because it's childhood obesity prevention. So the idea behind it was that we wanted to have create almost like an alternative snack list so that, you know, if parents, I guess, need a resource, we have a list of things that you can get that are going to be healthier options for your child, right? So, yeah.
And that's interesting that you said, you know, with the snacks that you would think would be more healthier.
Yeah.
There's some issue with that. Like you said, maybe more sodium.
Yeah, there are issues because if you think about it, most of our snacks are actually, first of all, they're mostly ultra processed foods. And when you're talking ultra processed, a lot of the times they're having higher levels of sodium in them to process them. You know, sometimes people say, oh, this is so healthy. It has less fat in it. But you know what? They've added sugar to create more flavor because they pulled out the fat. So these are kind of the trick things that people don't realize. Like if you go and you buy a low-fat yogurt, it's going to have in more sugar than a yogurt that has in normal fat, generally speaking, unless you're going to see no added sugar or a sugar substitute on it or whatever. So these, as I said, working in the area of diabetes, these are things that we have to teach our clients because when they see their blood sugar goes up and they're like, but why? I had this yogurt and whatever. It's like, no, go for the normal yogurt, maybe like a Greek yogurt, and it won't have in as much sugar. And also you have to think about flavors. Some flavors come with sugar because the flavor on its own don't taste so good. So you put in sugar then to disguise some aspects of the flavor. So this is what we mean by ultra processed foods. The foods are processed in a way so they taste like normal food or good food, but they're often processed sometimes even with things that you wouldn't really eat or, you know, expect to find, like, you know, food brand per se. You know, some of these things are chemicals, but the number one thing is actually a lot of processed food has and actually a lot of sodium as well. Yeah.
Wow. Thank you for sharing that.
Yeah.
And as we think about diabetes awareness, what are your thoughts on the level of awareness of diabetes and other non-communicable diseases in Barbados and even within the Greater Caribbean?
I think that the level is improving a lot because, I mean, for example, and this is, I think, Healthy Caribbean Coalition has done a great job throughout the region. And a lot of, so the Healthy Caribbean Coalition, their mandate is exactly what it says, creating a healthy Caribbean. So there are a lot of organizations in the Caribbean, which I think are almost, a bit supported and encouraged by the Healthy Caribbean Coalition. For example, there are certainly, you know, activities in Jamaica and Trinidad and Ghana, several places, because I've been to HCC meetings and you find people from all over the region. And so I think the nice thing about that organization as an umbrella organization is bringing for us more about awareness about that need to continue to bring like these really preventative messages throughout the whole Caribbean. So I do think that awareness is increasing a lot. We still have a long way to go. I wanted to make a simple point. And I thought about this. There are 3 levels, if I want to think about it simply. There's awareness. You can be aware of something. Then you have 2, that desire to do something about something. And then you have 3, is that actual doing of the something. And, you know, there can be a very big disconnect between awareness and actually having the actions to do something. So I think that we have awareness, but I think we have to improve that kind of moving from awareness to wanting to do to the actual action. And when you're thinking about kids actions depend on several things like us as well as adults, but kids' actions are largely influenced by their parents and themselves, you know, and it will vary between different children depending on, you know, what kind of relationship they have with their parents and who, you know, calls the shots in the family. Because as you would know, there are some kids who call the shots, and other places it's like the adults who call the shots. But I just stress that because as we think about going about planning promotions and stuff like that, we have to think about addressing all of those different things. You can't plan a promotion that educates kids that doesn't tackle the parents, right? And likewise, you can't tackle the parents and not the children as well, because the children might be, as soon as they throw a tantrum, they get what they want, you know, but what we want to do is teach them from very young, throw a tantrum for the right things or less of the wrong things, you know. I didn't mean that in a bad way or anything like that, but you understand what I'm saying. You have to really think about those kind of different things. But I think our barrier, or where we have to get past right now, is the action, because I think there's an action deficit in our population when it comes to preventing NCDs, etc. Yeah.
Thank you for sharing that. And talking about the work that these organizations are doing within our region. So I want to thank you for sharing that. And as we look at, thank you so much. And as we look at diabetes in Barbados, can you share your views on, you know, diabetes in your country as it pertains to the rate, prevention of diabetes, and the impact of diabetes in the country?
Okay. I can answer your question with one small thing, and because it's like, it's Frivolous Friday, I'll just follow up my chair and I will answer your question, right? Our rates are ridiculous, okay? When you start talking about nearly 1 in 5 people having diabetes is crazy, because you know that there are a lot of people who are actually not diagnosed with diabetes and they're not included in those rates. It means that your rates are probably higher. It depends on like what populations you look at, because there are lots of different kind of rates that are quoted. You know, some people will say, well, nearly 15%, maybe 18.9%, 17%, but sometimes it depends on what age range maybe you start at and you end off for, and also how you do your sample. But, you know, the rates are too high for a condition which is so devastating, especially, you know, when it's poorly controlled. And I mean, I do know that, you know, in Barbados, the majority of people, or even if you said 50% of their diabetes is not going to be controlled, you know, and simply because I guess, as I said, I know the impact on it, not just financial impact, but also the amount of suffering that it causes for the person and their family as well. You know, for me, it's like something you want to do, you know, better on. It's like you tell people don't smoke, and you had a massive smoking campaign, and we did have a very big reduction in smokers. We certainly have less smokers, you know, like in the Caribbean and Barbados than we do, say, for example, in the UK. But you tell your children don't smoke from the time they're small, and everybody around them goes, don't smoke, you know, or don't do drugs, you know. And that's the kind of thing I think that needs to happen for NCDs. I think we've become very comfortable with NCDs. It's become almost commonplace. Oh yeah, auntie has diabetes, granny has diabetes. Diabetes is the normal thing, you know, and I don't think I'm being unfair. I mean, I even related to personal experience with like friends, some of my friends who might not be medical, you know, and I would say, well, you know, well, maybe you shouldn't give your child whatever. And woo, who tell me say anything? You know, because it's like, why they can't drink, they drink. I always used to drink. So what's the big problem? He's a boy, he gonna run it off, he can do this. You know, but all I'm thinking is, okay, I'm there for the evening. It's like, right, I've seen this child drink about 3 or 4 drinks already. There's no water, you know, the child already, I can look at, they might be overweight or whatever is the case. So once again, as I said, it goes back, not just the child, but the parent as well. We have to change the parents, I think, understanding of what's going on, you know, in our countries and all of our islands, because I know you're going to have the same experiences we have in Barbados there, and help to give them that education. Because think about it, it's going to be really confusing for a child. Teacher says I can't do this. Mommy says I can do this. The Sunday school teacher says, well, you can do that sometimes. My friend says, they're so confused. What do you expect? It's almost like the COVID vaccine. Take it, don't take it. Yes, maybe you can take it. You leave people confused, you know. So we need to be on the same page and sing from the same hymn sheet. Yeah.
Definitely. And, you know, kids, they don't really understand. So it's definitely going to have them a little bit confused.
Yeah, they don't understand. Yeah. But what I would say is if you're brought up in a certain way from young, you tend to carry through a lot of those lifestyle habits with you. So if you're in a household where, for example, you know, maybe you go and you exercise with your parents go and walk and you go and you ride, or, you know, you don't get to have you don't have snacks every day, because some children literally, I'm not kidding you, as I said, I work with children in dancing, their idea of a snack is something that comes in a bag. Okay, so for them, you know, having a snack is not necessarily just having like an apple. That's not a real snack, you know. And it's the truth, you know. But you know, if you maybe make healthier snacks, if that's something that your child does from very young, you know, you're gonna find that they wouldn't necessarily be the type of child who may have to, you know, splurge on things all the time or drink drinks continuously. You probably have a water bottle, drink a juice sometimes, whatever. But you know, it's just to think about it. At the end of the day, you know, we're always products of, you know, our households and our environments, right? So even if a little bit of bad stuff sneaks in along the way, it wouldn't be like from day zero, this is your life, you know, and kind of trajectory. Yeah.
Yes, absolutely. We are definitely products of our environment.
Yeah.
And I know there's a campaign, because you would have talked about the labels, you know, pulling those labels. Some of us, I must confess, I'm not really good with even understanding labeling, to be honest.
Yeah.
So I know there was a campaign, and are you aware of the campaign to place informational labels on the front of food packages?
Yeah, that's something that's been going on in other countries for a long time. So I think we're catching up now.
Yeah.
But no, it's a good thing.
Yeah.
It can't be a bad thing.
So what type of impact how do you think that would kind of change the game for a lot of persons?
Yeah, I think it would change it dramatically, because as I said before, look at me. I'm a doctor. I'm in a supermarket running around with my camera taking pictures, but this is the back label, okay? And some of these things I'm going like, really? No. If you have somebody who cannot even read a label on the back of a package, how are they going to know what's inside of this thing they're consuming? How are they going to know? You know, there are a lot of people who don't actually, I would say, have what we would call it literacy, strong nutrition literacy. So that's maybe not understanding, not through any fault of theirs, but they probably weren't taught. I mean, I don't think I was really taught much about nutrition, to be honest with you. Not throughout medical school, not in a practical way. That's something that I learned later on, you know. And if you're not exposed to it in a significant way, you may not understand what you're eating. I work in the diabetes center, and of course, everything that's a carbohydrate is turned into glucose or sugar in your body. I mean, there are a lot of persons who come in here who don't even know what carbohydrates are. They will ask me like, well, if I eat beef, will it affect my sugar? Or, You know, they think that they can't eat or they say they can't eat the bread, but I can eat as much yam as I want. So what I'm saying, I don't mean it, as I said, I never mean to be rude or condescending, because I love everybody and I respect everybody where they are at. But I'm just saying that there are a lot of people who do not have nutrition understanding. And at least if somebody knows I have diabetes and they can see a label that has high in sugar on the front of it, they'll know, okay, let's backtrack. That's not for me. If they don't know and somebody has told them, man, I hear this thing here, good for you, it got a lot of fiber, because that's another way that people hide things. They go high in fiber, high in vitamins, and say high in sugar, right? But if the person doesn't know, they're none the wiser. I had a lovely lady here today. She bought a fruit squash, and because the brand sells a no added sugar one and then the sugar one, but it doesn't have it on the front, she went and bought the one with sugar, and she was drinking it and her blood sugars were going high. She came in here in a hot panic because she's like, bought this thing and my sugars or whatever. But then she laughed. She said, but then she finally looked at the label and realized it had an added sugar, but it didn't put it anywhere on the front of the product. So she was none the wiser, you see. And this is something that a lot of people get fooled up with who are living with NCDs. You can see 2 cans of corned beef, and one will contain 600 milligrams of sodium, another will contain 250. If you do not know how to read a label and you have hypertension, you are none the wiser, okay? So these simple front of package labelings, I think, will make it very easy for persons who have non-communicable diseases, NCDs, so they can choose products that might be more suitable to their condition. But also, you know what happens? If you have a person who has diabetes and she has children, she'd be thinking to herself, you know what? First of all, I don't want my children getting diabetes. So, and I see this in my patients, I'm relating things that are real, not things that I'm making up in my head. So you know what? They will go for some of the lower sugar versions of things for themselves. And the difficulty that they face is that they're living in a society where everything is processed, everything has in sugar and everything has in salt. So it becomes very difficult for them to decipher what is and what may and what may not be better, you know, for their children. But, you know, a person who has an NCD doesn't want their child to grow up and have an NCD as well. Or if their child is overweight or obese, they want to do the best for them. But if we don't give them the tools to do the best, it becomes very difficult for them.
And those are some important points that you raised when you talk about labels, especially for someone who needs to be sure and that they're already impacted by a non-communicable disease, and they need to be sure about their blood sugars and different their sodium levels. That is so critical that, you know, they have that information available on the labels for them to just choose and decide, you know, what their meal is going to look like. So that's very critical. And I want to thank you for sharing that. That's so important.
Yeah, it is, because at the end of the day, if you outside diabetes, if you have diabetes, you have to be able to control your diet to control your diabetes. There is no tablet or injection you can take that will control you if your diet is helter-skelter. It's not going to happen, you know? And we always teach people that the backbone of managing diabetes is actually nutrition. That is the first step, nutrition and lifestyle. Whether you have type 1 or type 2 diabetes, type 1, yes, you need to take insulin to survive. But the reality is that type 1 persons who have healthy diets are going to be generally better controlled than somebody whose diet will be unhealthy. And it's very important. And you have so many people with hypertension in Barbados and the Caribbean, you know, diabetes, cholesterol problems. We have to give them these easy ways of helping them along with nutrition, you know. So it's simple. It will be there on the front. In some cases, you even have what they call a traffic light system, where you can use like different lights to say, you know, go, don't go, that kind of thing. And so be, you know, good to see what we adopt. And, you know, would love to see it throughout the whole Caribbean. It's needed.
So Doc, I know you would have talked about type 1 and type 2. And just for those who may not be so familiar, seeing that you mentioned it, can you just briefly tell us the difference between the two?
Yeah, sure. So persons with type 1 diabetes, they're often diagnosed in childhood or adolescence, although you can still get type 1 diabetes as an adult, of course. And what happens is that the organ that produces insulin is called the pancreas. It's an organ that lies on the inside of your abdomen or the inside of your tummy, if you want to think of it that way. And it produces a special hormone called insulin. Insulin is a nice hormone. We always call it the lock and key. So it unlocks the sugar channels and lets the sugar move from the blood into the muscle. And once it moves from the blood into the muscle, it then gets burnt up for energy. So it's that constant movement of sugar from the bloodstream into the muscle that helps us to control our blood sugars. When you have type 1 diabetes, you do not produce insulin. So it means that the sugar builds up in the system until you get some insulin to let that sugar from the bloodstream into the muscle where it then gets burnt for energy. In type 2 diabetes, you're producing insulin. Remember, we said that the insulin is the key that lets the sugar go into the muscle cells to be used for energy. You're producing it, but it's like the key that doesn't fit, okay? So you're there trying to unlock. It's like unlock, unlock, unlock. Nothing's happening, right? And so therefore the sugar builds up in the system. Eventually, it will unlock, but after 20 tries. And so while you took 20 tries to open up the sugar channels, the sugars, they're building up in the blood system and getting high. So one is absolute insulin lack, and the other one, you're producing insulin, but it doesn't function properly in the body, and that's called insulin resistance. Yeah.
Thank you. Thank you so much for explaining that. Thank you so much.
Okay, I hope I explained. Anything you don't understand, just ask me.
Yeah, no, man, you did an excellent job explaining that.
I want to point out one other thing, Deirdre, before we go off.
Sure, absolutely.
And do you know what, in terms of the insulin not functioning properly, what we now know is that excess fat in the body, in the livers, particularly the pancreas and the muscles, they actually stop the insulin from working properly. So as we put on more and more weight, we become insulin resistant. Okay, that's why diabetes becomes more common. The more body fat, that you put on in your central part of your body, it becomes higher and higher. Another important thing, because we spent a lot of time last year trying to educate people about sugar sweetened beverages, is that when you consume sugar in excess, you cannot use it for energy. You can only use a small portion of it. All the excess sugar gets turned into fat and is stored in the liver, in the pancreas, in the muscles. So although people would say, but sugar doesn't cause diabetes, sugar does cause diabetes indirectly in excess because you convert it into fat, which then causes the body to dysfunction. So fat is actually very important in the body. It's not just storage. Fat does a lot in your body. It causes inflammation. It causes insulin resistance. It does a lot of other things as well. I just wanted to put that in there because we've done so much work around sugar sweetened beverages, etc. Yeah.
Yeah, thank you. And some of us love our sugary drinks. I know persons, that's the first thing they drink in the morning because they say it gives them the energy to go for the rest of the day. So
okay. Yeah.
So what would you say to someone like that? What would you say to them?
Well, first of all, we get energy from food, and our best source of energy is going to be the food that we consume as opposed to beverages, right? But I do actually, in fact, I know sugar is an addiction. I've got 1 or 2 patients who they're like, "Doc, it's not going well." They're addicted.
Oh wow!
Like literally addicted to Coke, stressed out, and they use Coke.
Yes, yes.
I'm serious.
Yes.
So sugar is an addiction.
Yes.
It may be a little bit of an addiction that their body has for sugar as opposed to an actual need of their body, right? But we consume more than enough. We get enough sugar from our diet. But as I said, what people probably don't understand is that everything that you eat that's a carbohydrate or a starch gives you sugar or turns into sugar in your body. It might not taste like sugar in your mouth, but it turns into sugar in your body. So that sandwich turns into sugar. The yam, the breadfruit, the green banana, all of the fruit that you consume, they're all sugar. And so we need to be very careful because what happens therefore to a lot of people is they're consuming all this excess sugar in beverages, but then they're consuming it in food as well. And, it's just too much. The body can't use it. And then it gets stored, turned into fat and causes a lot of problems then, in the body. The other thing I wanted to say to that person is a sugar addiction can be broken really in 2 or 3 weeks. It is about, because you have pathways in your brain, right? And those can actually be broken, but it requires consistent effort, to do it. And I've had some of the worst degrees come before me and they've changed it. Because you know what? It's like actually keeping my feet on, not being blind or not being on dialysis actually matters more, than having, the beverage. So I'm not saying that you can't have a beverage. I mean, water is the best drink. Really, we need water. That's our body is made of 70% water, but a lot of us don't consume enough water, pure water per se. And yes, you may occasionally have a beverage, but I mean, having a beverage to the point where you're drinking 3 and 4 of them in a day, that is a problem.
Oh, that's heavy. That's heavy.
Yeah, but the point is children do that. Children do that for sure, and the same way the adult does it. For some children, the first thing that goes into their mouth is a sugar sweetened beverage in the morning, And I mean,
so what's the alternative, doc? If you sit down and you want to have a meal, what's the alternative to drinking that nice can of soda? I know you said water.
Okay. But... Well, you can do flavored waters. I mean, here in Barbados, what we're recommending for children is that they would maybe have like natural fruit juice. But of course, natural fruit juice, hold on a second, it's Friday, Wacky Friday, is not fruit juice in a mug this size. You want a little small cup of fruit juice. When you go to the expensive hotel and you get this little bit of juice and you're like, where's the juice? That's what we're talking about. Okay. So, but me per se, yeah, I'm not really one for advocating for juice use continually throughout the day with food. I think fruit is a better source of you want to think of it, fruit juice than actual juice itself or naturally fresh squeezed kind of fruit, coconut water. Don't forget flavored waters. There are many ways that you can make flavored waters. My 2 things now are buying cinnamon sticks, putting them in a big container of water, and I soak it overnight. So it's like cinnamon water. It tastes great. Or you can do lime.
You went over that so quick. Well, could you repeat that again?
Cinnamon sticks, cinnamon.
Oh, okay.
Yeah,
okay.
So you just create like a cinnamon water. It's very kind of fresh. And also just like lime and water, and you can put a dash of Angostura bitters in it. There's several things that you can do. You can even cut up fruit and soak the fruit in it overnight, cut up lots of oranges and create infused water. So I think we may have to think about these ways in being creative. But you know what I think because sometimes people get sick and tired of us doctors and they're like, oh gosh, not her again. What's she talking about again? Because I think it's easy to do these things like if you don't have a problem, but you're not thinking about the problem that, is around the corner. And when we're talking about childhood obesity and overweight, you're talking about your child who might be 13 or 14, but I see children who are 18, 19, 20 to 25 who have diabetes, and I've even met some who have no immediate family history of diabetes, but they're diabetic. And, for the reality is that their lives have to change very early. And when we see people who have diabetes between the ages of, like, say, 20 and under 30, they probably were pre-diabetic as a teenager or an early adulthood and not realizing. So it is about choosing or making the choices for the life that you want to have, I think, down the road. And that's something that's hard, I think, for children. I mean, as a young person, it's like, I want to have fun. It's about fun. But we have to teach, we have to tie nutrition into a lot that we do. We had a good meeting on the weekend, and a point was brought up, and it's like, why are we not teaching nutrition to children in simple ways when they go to their dance class as a little one or their karate class? Why are we not tying nutrition education into the physical activity so they grow up with this understanding that taking care of their body involves, yes, exercising and having fun, but also everything that they eat into their body impacts them. And I think that was a very important point that was brought up. These messages need to be tied from a very, very, very young age, over and over again, the same way that I would have told my nephews when they were children about 50 million times, don't smoke, you hear? I said, don't do drugs here, don't have sex, you don't want HIV, I've seen it, you don't want it, but not in a threatening way, although I think I threatened my nephews, I probably traumatized them. But those messages need to come in from a very young age about healthy living and healthy nutrition, right? You love your child, do the best for them. You want to do it on all levels, not just on one level. Providing PV4s, or I don't know the name of the games, like all the fancy games. It's entertainment, but their health is very important. Give them those tools as well. But remember, I said in all fairness, give the parents the tools to give them, right? Because some of the parents don't have the tools, right?
Definitely, and that is an excellent point. Sometimes the parents need to be educated as well. So definitely that's very important. And also what you would have said, as a doctor, sometimes it may come off a little bit blunt, but I want to tell you, I remember in school days when we had persons who came through and they would have talked to us, well, for example, about AIDS and those viruses, and they had those slides with the things that could happen should you catch those, should you, be impacted by those viruses. That stuck with me as a child, and I still remember those things. And at that age, still being a young child, I remembered the importance of getting tested. That stuck with me. So I know as a doctor, you may say it's coming off a little bit blunt, you're kind of scaring them. I at least for me, I remember as a child, I retained those things, even though it was a little bit blunt seeing those things on screen. I retained that, and it definitely, helped me to appreciate the value of testing and the value of prevention. And so I want to thank you for sharing that, and also talking about the importance of educating parents as well, because they need to have the information in order to pass that information on to the child. So thank you so much for sharing that.
No problem. You're welcome.
And so I want to ask you about recommendation. What recommendations would you put forward to address the issue of diabetes in your community and even within the greater Caribbean? I know you are a part of organizations who are spearheading different programs and initiatives, but what recommendations would you put forward for the community?
Well, there's so many recommendations, but I think the first one I would go to is I think of it as in a stepwise manner. Number one is prevention. So prevent it from happening first. If you don't have it, do everything that you can do not to have it, and prevent your children hopefully from getting it either. If it's possible, type 1 diabetes, remember, is not preventable. Type 2 diabetes, maybe half of those people can be prevented from having diabetes. There's some people with type 2 diabetes, they'll do everything right and they'll still end up as a type 2 diabetic, okay? So just remembering there's a wide kind of spectrum or ways in which diabetes is. So prevention. And we've been talking about prevention here today. So that's number one. Number two, it would be screening. Get tested. Have it as if you have a family history of diabetes or you have other risks for it. Ask your doctor, your care provider, when should I get tested? And remember that you just don't test once for 10 years and that's it. It becomes a regular part of your medical. And it might be that maybe you may be advised to check, every 3 years or 2 years, and maybe you'll be advised to check on an annual basis. Okay, if you are diabetic now, so we're just kind of moving through that spectrum. So say, for example, if you're pre-diabetic, reverse it, get rid of it. The faster you're able to get rid of it, less likely you are to go on to become diabetic. If you can't get rid of it, live well with it. And this applies both to pre-diabetes and diabetes, and that means being controlled. So if there's something that I promote to my patients, and I say, because you have diabetes, it does not mean that your blood sugar needs to be higher than mine. Our bodies are supposed to operate in a specific way. So your idea of control should be having normal blood sugars as much as is possible. Even if you have like the odd high or there or whatever, or like my patient is really good, but oh my gosh, I ate the sweet bread. I couldn't turn away from the sweet bread. And then they had a high sugar. Okay, that's okay. Life happens. And sometimes you may want things that are nice, but in general, you want to control it and monitor it. And then my next point would be preventing complications. You prevent complications by controlling your diabetes really well and your blood pressure really well. It's very important to prevent complications, because the bad thing about diabetes is that when you get a complication, a lot of the time, even if you get yourself controlled after the complication can continue to progress and progress and progress. It's like the person who has, kidney damage, and they're not doing everything right, but then eventually over 2 years, they still end up on dialysis because the organ, there's so much damage, the organ continues to deteriorate then over time. So prevent complications. And that would involve a process of screening regularly for complications. You should screen every single year. And don't be one of those people who gets caught out and you haven't had your eyes tested for 5 or 6 years, because, by the time I test you, you may already have bleeding in the back of your eyes and you might need laser and other things, or you might be at risk of losing your vision. So screen regularly for the complications. And then my very last point is that if you already have an established complication, because everybody's not going to be able to prevent something, or maybe it happened and this is where life finds you now, live well with your complications. Still continue to control your diabetes. Your complication will decline at a much slower rate if you keep things controlled, generally speaking. That's a general, but we may not be able to prevent it from getting worse still. But live well. I always say, I think this more and more, I think as the older you get, we have one life and the intention should be to live our life well wherever we are and wherever we're at. And likewise, my work with people with disabilities encourages me in that pathway, because I have, friends who are in wheelchairs, but they live a good life. They're happy. They're not depressed. They're out there advocating and they're doing things, and I think it's very important to live well. Whatever stage of that big, long line I described to you, it's important to live well. Yeah. As I say, it's not over till it's over.
It is not over until it's over. Amen. You're preaching, Doc. You're preaching.
Yeah, I had to preach today. I have to preach today.
Yes, you're preaching, and you're correct. It's not over until it's over. And then you talk about persons, with their disabilities who are still advocates. I also know persons with disabilities are very active, and they advocate on behalf of their community, and so that's very important. So
a lot of stuff.
Yeah, sharing that as well. And advice. What advice would you give to an individual who might be impacted by diabetes, and what advice would you give to individuals to prevent developing diabetes? And I know you would have mentioned something important, and that is testing. You said not to do it once a year or every 5 years or every 10 years, but it's so important to, be more active in terms of getting tested. So I'll let you jump in.
So the first question was, what advice on what?
Advice
with diabetes. Yeah, so I always say, I think is realizing or thinking. I like to tell people, you are not your diabetes, first of all, okay? You are you, and your diabetes, it might be a part of your life, but it's not everything. So, because sometimes people get so kind of boggled down by diabetes, especially when they have a new diagnosis. All they can see is diabetes and how much their life has to change and what this means. And maybe I'm a failure, and maybe I won't live long, and maybe, okay? So you are not your diabetes, okay? And your diabetes is a condition, it's not a disease. So the other thing I think that's very important is go to reputable places for information, because you can read everything. Everything is everywhere, and not all information is good information. And even if you have learning, don't take and imprint everything you read onto yourself. Because you have diabetes and you read that, okay, well, 25% of the people in this get, say, for example, kidney disease. Why you don't have to be that 25%? Why are you even internalizing, that kind of negativity? So it's really about trying to put it in a positive light, because people who have a positive, I think, I want to say necessarily positive or a more accepting relationship with their diabetes, they're more likely to do well than people who have a very negative kind of relationship with it. Things are about acceptance, first of all, accepting it. then understanding it. And then I would say the other thing is getting support for it, having good support. That's really important from your family. And that doesn't mean just your family, you know, oh, she's diabetic, oh, you know, I'm going to treat her like, no, it's about your family actually now learning about diabetes, learning about how you should eat. And actually, maybe they're even eating the same way you're eating. So it becomes easier, you know, for you. So the family has a great role to play in supporting persons who are living with diabetes. So that's just my simple advice. And also, it's always about suiting, or I would say constructing care in a way that suits you. At the center, we always, and I tell my patients this all the time, I give them the information. I say, what are you going to do? I'm not telling you what to do, because I'm not going to come home and do it for you. Do you understand? I'll give you my advice, but you're going to make that choice. Because when you make the choice, you're going to do it more likely than if I tell you 50 things, don't eat, don't touch, don't whatever. Okay. And sometimes as well with diabetes, you have to make progressive changes. Remember, it's something that the person is going to live with for a very long time. So don't try and shove 10 different things down their brain. Maybe we just choose 2 or 3 so small, or 1 or 2 small goals that the person can manage. And I think the beauty of doing that is that every time that when they come back, they feel like they're winning and succeeding, as opposed to failing because you may have given them too much to accomplish at a point in time. And my final point, if you have diabetes, because I get this with a lot of people, oh my gosh, my blood sugar is 18. I don't know what's going to happen. The world's going to end. I'm terrified. I'm going to have like a mental breakdown. I say, stop. First of all, you're not going to die. First of all, just chill. Okay. The more important thing that you learn from checking your blood sugars is you have to learn. You have to see checking your blood sugars as a learning experience as opposed to a judging yourself experience. Okay. So if you saw that your blood sugar went up, start asking yourself, why did it go up? Okay. What do I need to do differently next time? Maybe I can have less of this. Maybe I don't need to have 2 of these. Maybe I can have 1 of this and 1 of this. Oh, shoot, I forgot to take my medication. Well, maybe you need to put your medication in a little container or somewhere so you remember it. And that's something that works really well. It helps to reduce a lot of the anxiety that people are feeling. Make sure that you use your information to learn, and don't judge yourself with every single number that you have so harshly. I mean, don't be lackadaisical about it, but, you know, go easy on yourself. You're human and you have the capacity to learn, and you will get it right. Yeah, but you may have to give yourself a little bit of time to get everything right. And that is okay. Not too much time, but, you know, just slow down on yourself a little bit. And then finally, you said, you mentioned, I think it was prevention. We've been discussing prevention all night, you know? So I think live a good lifestyle, take care of yourself, you know, try to be physically active on a regular basis, eat properly, do not overeat. If you go to a buffet dinner, that's fine, but you can't be overeating every day and think that it won't impact your body. And this applies to adults and children. Because a lot of times when you go out, you'll see when people take away food, you find the portions are huge. And you wonder, how's that poor child going to eat all this food? But the portions are huge. You know, if the portions are big, maybe break them down. It's like me, I didn't eat much today. I had a lot to do, but I bought something. And I was like, yeah, girl, you put it on. She gave me a bit of food, but I'm like, okay, I got halfway through it. So I'll put the rest in the fridge, and this will be my lunch for tomorrow, you know? But the same thing with the kids as well. Try not to let the kids, you know, overeat portions. Children should be eating from small plates, 7-inch plates, not big adult plates that are full. That's too much food for a child. And if you don't know for a child what they need, go to a source and find out what their portions are. A lot of children are actually just overfed from the point of view of portion sizing, etc. And then for adults, as I said, it's about portion sizing. It's not just about the sugars. You want to make sure that, you know, you're not overdoing it on your portions, not surpluses of calories, because you'll store all of that as fat. And likewise, the added sugars as well, as we would mention, they're very, very impactful, because a lot of our added sugars actually come as beverages. And we sometimes don't really think about them or count them. So I hope I answered your question.
Thank you. Thank you. Thank you for that information. And, you know, as we wind down and as we come to the end of this session, Are there any additional comments that you would like to add? Is there anything else you would like to share?
I think I've shared quite a lot. I think people are probably tired of hearing me right now. And I know that medicine and health is not always like a sexy kind of trending topic. I mean, if I were here in the bikini, you'd probably have like 2,000 followers on now, just clicking and clicking and clicking, right? So it may not be sexy in that sense. But remember, at the end of the day, all we have, to be honest, all we have in our lives, we have two things: is we have our family and we have our health, right? And it's very important. If you do not have good health, you know, you're not necessarily going to have an enjoyable life, because, you know, you're going to be boggled down with doctor's appointments, expenses, tests, not feeling well. And, you know, you enjoy life when you really are in, you know, your best kind of possible health, which reminds me, I have to go and join the gym again tomorrow. That was just an aside. But you know, I'm just saying that was a joke. You don't laugh. It's Friday. Come on. But yeah, I think just value, you know, value yourself. And part of valuing yourself is taking care of your body. And it's the only body that you're ever going to have that's going to take you through this life. So treat it well. That's all I have to say.
Thank you, Doc. Dr. Diane Brathwaite, Doc, DB. You know, you have all of these.
Yeah.
You have all of these names, Doc. But I want to thank you. Thank you for sharing the information that you would have shared today. And I'm sure, you know, it's impactful. And the good thing about it is the sessions are always available to go back, to look back over. So
yeah,
I want to thank you. Thank you so much for sharing your knowledge and insight, you know, in working in the field that you work. And you see this firsthand, and you know the effects and the impact, you know, of diabetes. And like you said, just reiterating from the beginning, there's so many, you know, drawbacks. There's stroke you have to think about. You have to think about possible blindness. You know, the impact of diabetes can, like you said, you know, the blood starts from at the top of the head to your toes. And so diabetes can have an impact on your liver. You talk about all of that. So, you know, that is very...
Yeah, it impacts everything. And you have to remember that, you know, it causes premature death as well. And that's really important. So, you know, a lot of persons, well, depending on your duration of diabetes, I mean, you know, you may survive 25, 30 to 50 years, but it means if you had it from young, you know, it increases your risk of, you know, having, you know, heart attacks and strokes that will end your life before you're 50 or before you're 55 or 60. I've had patients recently, quite heartbreaking, really, you know, just 50, 55 who, you know, died, and they were getting everything right and feeling good. And then I got a phone call saying, well, you know, this person died last night. And I was like, I don't take young death well. But yeah, and as I said, I think, you know, people would say, oh, she's just talking, but, you know, seen it. I've been doing it, you know, for 20 something years. I've just seen things, trust me, that I know people don't want to see, and not on the scale that we see. And even if you think about Barbados, you know, the majority of our hospital beds in Barbados are occupied by persons with diabetes, you know. So it is a reality. Yeah, not a fallacy, it's a reality. So you have the power to change your reality, but you have to choose what you do. What you do determines, you know, where you're going, like anything else in life. Yeah,
absolutely. And that's why we have these organizations, and a big part of it is knowledge. You know, knowledge is empowerment, and, you know, sharing the information that people need. So I want to thank you for being on the front lines, like a little soldier. You're on the front lines getting that information out there. So I want to thank you so much, you know, for the work that you are doing. Definitely making a difference in our community. And it starts the little babies, and not just the babies, but educating the parents as well, because that's key.
Yeah, and before they have the babies. Yeah, no, seriously, before they have the babies. So what happens in utero actually can impact what happens to your child, right? So I just want to say thank you very much, not just for myself, but also on behalf of the Childhood Obesity Prevention Coalition of Barbados, who I'm representing. And we are happy, you know, just to reach out, connect, partner with your organizations over there, because I'm sure you're going to have organizations out there who are doing similar things. I think what we're trying to do really in the Caribbean is to create a strong network where we're supporting each other.
Absolutely.
For our children. It's not
Yes.
for us, you know, it's for our children and for the Caribbean future, basically. So thank you for the opportunity.
You're absolutely welcome. And you're a friend now, Doc. You're a friend. So you're welcome at any time. We call you friends. We call you friends.
Thank you very much, friends.
Yes. So your initiatives, your programs, you know, you're welcome back anytime to talk about those and discuss.
Yeah.
So again, you want to add something?
No. Mm-hmm.
Okay. So again, I want to thank our guests for being here today on this informal Friday. Yeah. I want to thank our guest, Dr. Diane Brathwaite. Mm-hmm. Did I get it right?
You got it totally right. Mm-hmm.
Thank you. Yeah. I want to thank our guests for just, you know, sharing her knowledge and insight with us today. I want to thank our viewers for listening in. And I would like to thank our viewers for just, you know, listening in again. Like our page for future notifications of upcoming talks. Comment under this video. Let us know your thoughts. Comment under our other videos. You can comment on our page. Let us know what you want us to talk about. You can also subscribe to our YouTube channel, Can We Talk, our Instagram, Twitter, using the addresses provided on our page. Doc, would you like to share any of your pages, your social handles?
Yeah, well, we're Barbados Diabetes Foundation. You'll find a lot of information also in another organization, sister organization, Heart and Stroke Foundation. And of course, please follow Healthy Caribbean Coalition as well. As I said, it's a regional umbrella organization, so follow them and you'll get a lot of information. If you sign up to their webpage, you get newsletters as well. I just want to wish all the viewers, first of all, a happy weekend, a good weekend. COVID has us all kind of, you know, a bit stressed, especially, you know, in Barbados, it's a bit tickly right now. But have a good weekend and take care of yourselves. And I also just want to say that if there are any questions in relationship to anything that we've talked about, I will come back and answer them on your page for you. Okay?
Awesome.
No? Yeah.
Absolutely. Thank you so much, Doc. So with that, Doc, you laughing at me.
Yeah. Happy Friday.
I know, right? So with that, we've come to the end of our session. I want to thank you all, and we are good. So can we talk? Thank you.